March last year, South Africa was plunged into alert level 5 to try and curb the spread of the coronavirus. And with that came the ban on tobacco sales. But did the tobacco ban actually work? Well, I'm joined by Joan van Dyk, Bhekisisa Senior health journalist, to look at the economic cost of the ban compared to its results. Joan, thank you very much for talking to me. Tobacco users, did they really quit or smoke less during these bans?
Yes, well, while the sales ban was in place, there was actually a decline in the number of smokers across the country. The decline was about between 9 to 15%. And not only did fewer people smoke at all, the people who didn't quit smoking, who kept going, those people were smoking about 2 cigarettes less every day than they did before the ban. But unfortunately, that's not something that can be said for the current moment. That was a kind of a temporary win against tobacco use, because the fewer daily cigarettes didn't quite last when the ban was lifted. That shot back up to slightly below where it used to be. So it's still lower than it was before the ban, but people did start smoking those extra 2 cigarettes a day again. And overall, the legal market shrunk from about 20 million sticks per year to 13 million sticks per year. So it kind of worked.
So does that mean that maybe smokers did believe the government for their reasons of banning cigarettes during the lockdowns, which were so people can quit and so we can make space in hospitals and also to reduce infections? Were people convinced with those reasons, thus maybe some were, smoking less?
Well, I'm not sure that we have a good sense of smokers' sentiments and what arguments they used for quitting. That's not something that I've seen. But what we do know is that the increase in prices of cigarettes does seem to be something that kind of works. During the sales ban, prices increased by more than 200% than what they were, and that kind of also went hand in hand with the decrease in use. So what researchers are saying now, tobacco control researchers, is that now we can see that price hikes are one of the strongest incentives for people to stop smoking. They also kind of argue that the tobacco industry can probably handle more higher excise rates, given that they've kind of recovered from the sales ban so robustly.
What was the downside, Joan, to the ban on cigarettes during lockdown?
Yes, unfortunately, so we saw a little bit fewer cigarettes a day. The market shrunk quite a bit during the sales ban, but that was kind of at the cost of a lot of work that the South African Revenue Service had put in to curb the illicit trade. So it had a real downside. Another thing that researchers say is that the same effect of those people quitting their tobacco use, that probably could have been achieved by just hiking the excise taxes significantly when lockdown started, instead of banning sales completely. And that would have you would have seen the same decline. And added bonus, there's 5.8 billion rand that the Revenue Service couldn't collect, and then they would have had that extra 5.8 billion towards the COVID response or whatever. So that's the argument. That was the downside of the tobacco ban. Also, the illicit trade totally boomed during the sales ban, based on kind of existing illicit routes that were used.
Just as we wrap it up, Joan, do you think that maybe support should be there for those who do want to quit, if government really wants to be successful in a campaign for, banning cigarettes or stopping people smoking?
Absolutely. I think, I don't think there aren't many people left in the world that think that tobacco is good for you. So I think just saying that, tobacco is bad for you is not really enough to get people to quit, especially in a stressful time. And just closing the taps, I don't think there were some people that wouldn't have worked for. So definitely support systems and kind of quitting programs would have been helpful for lots of people to stop smoking.
Well, thank you very much, Joan. Let's hope more people stop the habit. That's, of course, Joan van Dyk, Bhekisisa Senior health journalist, talking to us about how some people actually did manage to stop smoking or have at least tried to smoke less.